welcome back from the commercial break. Thank you for staying tuned. As I said earlier, we're discussing autism today, and April is Autism Awareness Month. We're going to know all we need to know about autism tonight, and we have 3 experts to help us with this. So we'll just jump right in. I'll start with Dr. Amponsa Kodia. What is autism, and why is it so important that we need to know about it? The whole month of April has been set aside to create awareness. So what is autism, and what do we need to know about it?
Okay, thank you very much, Na, and good evening to your viewers. Autism is one of the developmental disorders. So say it's a type of developmental disorder with certain key features. And if we say developmental disorder, when a baby is born, as they grow bigger and taller, they acquire certain skills like sitting, like walking, like talking. So those are developmental milestones. So things that they develop as they grow.
Okay.
And there are timelines. So there is a time that a child is supposed to be sitting, time is supposed to be walking, supposed to be talking. But there are also a few children who do not develop um, as the other children. So they don't follow the usual developmental timelines or milestones, or they develop a little bit differently from what is usually seen. So we say these are developmental disorders, and autism is one of them. And there are some key defining characteristics. There are about 3 of them. So one is when they have challenges with communication. So a child with autism would have challenges with his or her communication, and both the verbal, the spoken one, and then the non-verbal, so the gestures and then the other signs we
Okay.
do when we are talking. And then secondly, they also have challenges with social interaction.
Okay.
So children usually play with each other and other, even adults, but children with autism have difficulty with social interaction. And then thirdly, they tend to have repetitive movements. So these 3, so challenges, communication, challenges, social interaction, and then these repetitive movements characterize autism's features. They are likely to have autism. However, there are some children who have mild autism. There are those with moderate, there are those with severe. What that means is that children with autism show these challenges to different degrees.
Okay.
So those with mild, who are mild on the spectrum, will show fewer of these symptoms, or show them to lesser degrees than those who are on the severe side of the spectrum. So they will really show florid symptoms, or a lot of the symptoms that I talked about, or the
Okay.
challenges that I mentioned. And it's important we talk about it. So the month of April, full month, is committed to creating awareness, because now it is there. Autism exists. People are affected by it. There are a lot of parents who don't know what it is. And if their children are not developing well, they don't know what is happening. Some of these children may have autism. And then we need to create the awareness, because children with autism can be helped.
Okay.
Chances are that if you don't do anything about it, they are going to get worse. But there's a lot that can be done to help these children with autism. So people need to know, so that we can help these children.
Right, right, right. Right, so I'll come to Ms. Nyako. Dr. Mponsakodi has mentioned already that autism is there and it's real. So do we have any numbers to support this in Ghana? How common is it in Ghana?
Well, I don't know, with Ghana and our way of documenting some of these things.
Mm.
I've not really come across the
Okay.
statistics yet in Ghana
Okay.
because quite a number of people are not really diagnosed. They are in our community, we see them. So currently, I've not really seen much in terms of the statistics. But I know that even in the US, where um, things are well structured, I know that with their statistics, there's one in every, let's say about 44 birth currently, and then one in about 166 girls identified as children with autism,
Okay.
and then one in about 27 boys. So what it means is that even with the US statistics, there's more prevalence in boys than in girls. So with the US study, that's what we are based on now. But in
Okay.
Ghana, I've not really seen any real statistics. I'm not too sure whether Dr. Kudia would be able to speak to that in terms of the statistics.
Okay. Okay. Dr. Amponsa, do you have anything to add?
Unfortunately,
Yeah.
unfortunately, no.
Okay.
Unfortunately, yeah, I also don't have any statistics in Ghana. For some of the other developmental disorders, yes, there are some figures out there, but for autism, unfortunately, Ghana, we don't, I haven't seen any statistics myself. So we
Yeah.
need to do more research there.
Yeah. 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 Definitely. Okay. So, Mr. Fa, Dr. Amponsa Kudia mentioned three main things we'll usually see with a child with autism. Are there any other conditions that may look like autism that are not necessarily autism?
Of course, I'll start from the recent research done by, um, let's say, the US people during the COVID time. They came across something called screen time autism. So the screen time autism has been exposing your child to the screen time for the number of time, especially when you expose your child from 10 months to like 24 months consistently. The child will come out with some of these characters that we've been seeing in children with autism. Yeah. And we also have this one is the more challenging one, the social communication disorders. So children with the social communication disorders always, most of the times, have this kind of autism spectrum characters. Even though social communication disorder is a hallmark of autism spectrum symptoms, and it's not always necessary that when a child is maybe diagnosed as social communication disorder, the child is being an autistic. No, there is this huge difference between this. So one is the social communication disorder, which the child will be coming out with, be isolated from his or her peers, not able to communicate early, have poor playing skills due to some conditions or some factors. And we have the obsessive compulsive disorder, which is also very weird, and the characters also seems normal and seems similar to the autism. So that one deal with the repetitive behavior, where somebody keeps on repeating some activity for long, and it can happen in adults and children as well.
Okay.
Yep. And also that some strange way of arranging their things in life. You know, we have some of the signs like these kids usually line things up, meaning the children on the spectrum line to put their things in order, line them up. All children line their things up, but when it's become too much, like your child is always lining things up, want to put these things in order, or an adult, then it's also another condition, but it has a similar or a same signs on the autism spectrum disorder. Yeah.
Okay. Okay. I don't know if anyone else has any addition to that. But otherwise, I'll ask Dr. Amponsa Kodia, you mentioned three things. So say a child has maybe just one or two out of those three. Will that child still qualify as a child living with autism?
Okay, so there's a way of testing or diagnosing
Okay.
these children with autism. they have to meet a certain criteria. So if they don't meet it, you don't diagnose them with autism yet.
Okay.
So we talked about challenges with communication. So this child may not respond to his name. So a child at a particular age, a certain age that he's supposed to at least know his or her name, and 10 challenges with communication. They may also not understand gestures or nonverbal skills, so the waving, the pointing, and all the other things. They may not understand expression. So you're crying, you don't really see what the big deal is, or you're smiling and you expect them to smile back. So those are things that we usually do. I mean, children would normally acquire or learn as they grow, but children with autism may not do these things. And then you also have the repetitive movement that Clement talked about. So lining of objects. You may have some of them even taking books, and instead of opening them or flipping through the pages, they will just line them up or tear sheets of paper into pieces and then line them up, or may spin around in circles, or just enjoy looking at the fan as it spins around, or even flap their hands for a long time, and they'll just be there flapping their hands or bouncing up and down. So these are some of the repetitive movements that children with autism show. And then the other aspects of social interaction. So challenges with social interaction. A child with autism would usually want to be by himself or herself, just playing in their corner, and really so they're just there by them. They wouldn't want to mingle with other kids. I mean, children will usually want to play with themselves when they are in a group, or do what everyone is doing. So they are in class, they are just doing, following what the teacher tells them to do, imitating the teacher and all that. A child with autism would not do that. May do something, repeat something after everybody has finished doing that activity, then they just say something. Or when you say, "How are you?" then they will also say, "How are you?" We call that echolalia. Um, they will not respond appropriately. So these are the challenges in communication, social interaction, and then these repetitive movements. Now, as Mr. Ifa mentioned, there are certain things that look like autism that is not autism. So he talked about obsessive compulsive disorder and then the other things.
Yeah.
And then we also have some children who may just have hearing impairments. So they are not hearing well. You call the child, he may not mind you.
Yeah.
And maybe they are interacting well and all that. If they see you, the gestures, they would understand and come. But if you call them, they will not mind you. So it's just a child with a hearing impairment.
Yeah.
You may also have a child who is just um, hyperactive, just moving about, and so doesn't even have time for you. And actually, some children with attention deficit hyperactivity disorder is also a disorder on its own, tend to speak late. So if a child is not speaking, it doesn't mean it's autism. So now, as I said, there's a criteria they have to meet, and that's why screening is important. If you see anything which is a little different from the usual, you have to get your child screened. Don't go ascribing diagnosis to a child.
Yeah.
And I see parents who would not want to have their children assessed because they are scared that it may be autism. But there are so many other things that could be the diagnosis
Yeah.
other than autism. So if you have one, it doesn't mean you have autism. Even if you have all the three, let a professional assess the child.
Yeah.
That's what I'll say.
Okay. 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 So, what factors influence the development of autism, Ms. Anyako?
Well, I think basically it's come to a notice that it's more of the genetic, that we've seen that in most cases, there are people, I mean, the children that we've seen over the years, they tend to have other family members who may have some, traces of autism. And it's just that when you go to that particular child, you can see more of the characteristics, and sometimes you hear parents say that my child didn't speak early, these are some of the, most of the things that we just mentioned. And we say that, oh, your uncle or your uncle somewhere, your auntie somewhere didn't speak early, was, not playing with other children. Some of the traits that we just mentioned. So it has to do with more of the genetic than the environment. I've also heard research that had gone into finding whether the vaccine that we use in vaccinating our children triggers, or autism. But even that, I think it's being challenged. And if you see, I always say that if you see the symbol for autism, it's actually a puzzle. We still can't find the causes of autism as at now. Yeah, theories banded around. As at now, we still not find the real cause. But in most cases, they are saying that more genetic factors.
Right, right. So you mentioned that it's more genetics, Mr. Efa. Is there a way to prevent it? Is there something you can do so that your child doesn't get autism?
As of now, there is no prevention to autism,
Okay.
but there is a treatment option. The first treatment option is the early diagnosis and early intervention. So we are in an era that we don't sit down and say, oh, boys don't talk early or girls don't talk early. No. Now the system of change. So now when you see any sign, I think the best way, as Dr. Kodia said, is to run to the specialist and find out. There's no harm in having second opinion on this. So go out, see a specialist who is into that field, ask him, my child is at this age, and comparing my child to maybe the siblings, it seems like, or I'm thinking the speech has delayed. Then you do the necessary diagnosis and assessment. Then you can come out and say, okay, now your child is free. It's just a developmental delay, or it has been caused by any other factors. So we don't sit down and say, oh, my child, boys don't talk early and blah, blah, blah. No, we don't do that. It's more of going out, being diagnosed, and have an assessment so that you can come out and say, okay, to clear your conscience that, okay, my child is free from this, it's just development, and the best way you can go by it. But as of now, there is no preventive measures that you can put down and say, I can prevent myself that my child won't get autism or not.
Okay, okay. So we've mentioned specialists who can help to diagnose autism. Which specialist do I need to see? I'm a parent and I need to find out or confirm if my child has autism. Which specialist do I need to see? Where do I go to? Dr. Mpansa Kodia.
Well, can I take that?
Okay, I think Mr. Nyako can take that.
Mr.
I'm sorry,
Nyako.
now was the question
Okay.
address? Okay, so. Hello, Na.
Hi, Dr. Mpansa Kodia. Yeah, so I was saying that we've mentioned specialists who can
great.
help with the diagnosis of
Specialist,
autism.
right?
Yeah.
Yes, yes.
So who does a parent walk to, or who does a parent see if they're not sure if their child has autism or not?
Okay, so it's important that you see a general pediatrician,
Okay.
because they are the ones that would assess the child holistically. So, they would examine the child and then they would screen the child. And then if after the screening, they realize that this child has a lot of the symptoms or is at high risk for autism, then they can refer to a neurodevelopmental pediatrician or a psychiatrist who would run them through the diagnostic criteria and then tell whether they are on the spectrum or not. And there are also times that people go straight to the speech therapist or the occupational therapists, because they are the ones that are available where they are. There are also people who work on children with autism. And so if you don't have a general pediatrician to see the child or a medical officer to screen therapist, these people can also help to screen the child and then maybe refer to a developmental pediatrician or a psychiatrist or even a general pediatrician to further assess this child. So these people are available to help with the treatment and the
Right.
diagnosis. Yeah.
Okay. So we've seen lately that there are more people we realize have maybe autism. Is that a true reflection of what's actually happening? That there are more people being diagnosed with autism, or it's just because previously we weren't aware of what autism was, so then we couldn't diagnose it? Mr. Nyaku, can you help us with that?
Well, I think one of the education, World Autism Awareness, month also has brought out the fact that people are now educated and they can now identify what are the causes of, when they see some of these traces, they tend to run to the hospital and get diagnosis and all of that. Previously, we don't have that because, of course, when they see a child showing those signs, those characteristics, they don't even know where to go to. And sometimes they just turn them into Insuba, and then they give them all sorts of names, spiritual names, and find a way to Ijanopine in that kind of system. But now there's so much education out there, even in the schools, when they begin to see preschool, when they begin to see some of these signs, they draw the attention of the parent, they ask them to see the doctor, and then it turns out that your child has autism. It doesn't mean that that is the end itself. There are some help out there where parents can now access. So I think now parents are coming out more because their support system, the doctors are diagnosing them appropriately. It's not somebody giving the diagnosis, and that's why you see more people coming out, or getting diagnosed and getting all the necessary support.
Okay, okay. There's this impression that children born with autism are like it's like a spiritual, there's some spiritual thing in addition to it, right? Is that true, Mr. Efa?
That's some of the myths that we've been hearing about.
Yeah.
And that's rather unfortunate for people to go by saying children having or children on the autism spectrum are being from so and so. I don't want to mention them because I really love my kids here more than that. Yeah, it's one of them, but it's not true.
Okay.
It's not true. This as adding up to Dr. Kodia and my colleague here, it's like there has been an advanced diagnostic criteria, and people are really getting to know a lot about these developmental challenges. So it's not like another myth go like it's an autism epidemic. No, it's like people are really getting to know and understand the condition. So people are really referring themselves or advising people to go out to seek for second opinion.
Yeah.
So people coming out to say it's a spiritual thing. There's no evidence or facts backing that.
Since you mentioned it, is it contagious?
Not at all.
Okay.
Then I would have been one having it here.
Okay. I'll come back to Dr. Amponsa Kodia. You know how we're able to diagnose some conditions prenatally? Is it possible to know if the child I'm going to have would have autism?
Well, I mean, I don't think you can do that. We've not read any literature that says that predatally, children can be, even baby unborn can be diagnosed. We've not read any research that suggests that they can be diagnosed even before the baby is born. We've not got into that level yet.
All right, but is there a particular age at which a child can be diagnosed with autism?
Well, like Dr. Kodia said, when a child is growing up, you look at all the developmental milestones and by the age 2 years, 1 year, you expect the child to do certain things, and so you tend to compare, that my child is 2 years, my child is 3 years. This is the characteristics that he's showing. He's not responding to his name. He's not saying anything. He doesn't play with any other, child around, and so on and so forth. So usually by 2, 3 years, the red flags is raised, and then people tend to see the doctor for an assessment, just for them to be sure what is happening to the child. So between 2 to 3 years, sometimes you go beyond 3 years, 4 years, you'll be able to see a doctor for the necessary diagnosis.
Okay, okay. From what we've learned so far, we see that they have some deficits generally, so it might affect their learning as well, right?
Yeah.
So, Mr. Do they need to attend any special schools, or are there any special schools like for children with autism?
Oh, okay. That basically will come out from the assessment.
Okay.
So if your child is maybe at the level 1 autism spectrum disorder or level 2, level 3, when your child is at level 1, meaning your child needs support, is a mild type of autism. So that one, we always advise parents that, okay, let your child join an inclusive school so that the child will learn from the other people. And when it comes to
What's an inclusive school?
The inclusive school is where we have a combined of children with maybe developmental challenges or special needs with the typical growing children as well.
Okay.
So that we have people who have been trained to understand how to combine these two people together and provide the necessary education and treatment for them. So that's the inclusive kind of education. That's something that we've been all advocating for, so that all schools or majority of the schools in the country will do what we call the inclusive educational system, so that children with some basic needs or with these developmental challenges can also benefit from, not like we've been isolating them. Actually, there are some cases that is very rare, that's the level 3, the severe type, that you have no option than to send a child to a special school. So the special schools are also much important. But that one will come out from the diagnosis, the level and the type that your child is on the spectrum.
Okay, okay. But let's say for a child with level 3 autism, are there schools available like that in Ghana?
Not all that much. In Accra, we have a lot of schools that's doing a special schooling system. But going to my Kumasi and other regions, we have little schools. Even though we have the schools, but comparing to the city Accra here, is more advanced than the ones we have in the other regions.
Okay, okay. And you mentioned the inclusive education, right? Are the teachers trained enough to deal with these children? Or is there any provision for the teachers to learn about it?
I think this question will require me like 4 hours to explain this. I've had some little challenges with some teachers. I put teachers in this range. Teachers who think that they know, and indeed, they know a lot about the autism spectrum. Some people too who think they know, and indeed they don't know. And some people who don't know, and they don't know, and they don't mind, they don't care, like they want to know and help the other case. Yeah, when it comes to this special like autism awareness, autism is a spectrum. It's a range of characters, types, and symptoms, and it has different treatment and approach. So sometimes I've had an encounter with some teachers that goes like, oh, I used to have one in my class and I did this and it worked. It's never the same, and the treatment approaches to is different. Yes, so I'll urge like the teachers always have to side with the therapists, the occupational therapists, the speech, the special educationists, so that these people can come together so that they can put on some objective and subjective matters that they can do to help each other differently or each other differently.
Okay, okay. Dr. Mponsa-Kodia.
Yes.
Yeah, we missed you earlier. I don't know if you have anything to add.
Just to add to what Clement said, we usually say that if you see a child with autism, you've seen only one child with autism, because I mean, you have two people on the spectrum and they are not the same. They may have different needs altogether. So with the school system, what we really would want is that source so that they can take care of these children, so not just children with autism, but other developmental challenges, so that as they learn alongside the children who don't have challenges, they will pick something from them. Unfortunately, we don't have a lot of such schools in the country. So what some of us do or recommend is to have the child get some intensive therapy or training. So the speech therapy or occupational therapy, they do it intensively. And then when the child um, has acquired some of the skills that you want them to acquire, then we transition them into the regular schools. Sometimes with what we call a facilitator, somebody to help the child integrate in the regular school, because a lot of the schools don't have the support system available. So after training them for a while, we transition them into the school with a facilitator, somebody who has been trained to help them transition. And then gradually, this facilitator is weaned off that child. And so there are also parents who would want their child to be in the regular school for some days and then also receive therapy the other days of the week. So those are things that we are doing now to help these children, because the ideal is to have every school having trained teachers, having therapists coming there to help these children in the classroom and then also to receive therapy. But unfortunately, that is not what we have in
Okay.
the country. And so we still try to help these children.
Okay. So Dr. Mponsakodia, maybe from your experience, which which have you noticed is better? Is it better if they have more therapy sessions than the like regular school, or maybe more regular school than the therapy sessions?
Okay, so it actually depends on the severity
Okay. Okay.
of the child's condition. There are some children who just have a few of the symptoms. And so these ones, you can straight away just let them be in the regular school. You may tell the teacher or train the teacher a little bit to know how to handle the child, or the facilitator to help the child integrate into the school and then pull the child out some of the time or some days of the week or some hours of whilst they are in the classroom, and then offer some one-on-one intensive therapy, maybe speech or a bit of occupational therapy, helping with the writing and all that. And then there are also those who are really or being on the severe side of the spectrum. And so these children may spend more days doing one-on-one intensive therapy, either at home or a therapy center. And then when you realize that they can now be in a regular classroom with some help, then you transition them. So every case is different, every
Yeah.
child is different, and that's why assessment is key. Then you know the recommendation, the best recommendation to be.
Right. Yeah. But is there a place for medications in the management of autism? Dr. Mponsakodia, I'll just stick with you for this
Okay,
one.
so okay, yeah. So it depends. Some of the children with autism have other medical conditions. Some of them have allergies, very bad allergies that you need to treat or manage. Some
Okay.
of them also have epilepsy, so convulsions. They have convulsions, and you'd have to also put them on medication if they have epilepsy. Some of them are also very hyperactive, so they have in addition to the autism, they may have ADHD, which is attention deficit hyperactivity disorder. And for them, we first of all do behavior management. So getting them to sit still, to focus, and not just be moving about, using behavior and modification therapy.
Okay.
If that doesn't work, or they are growing a bit older and this time you really need them to sit down and focus and study, then you also bring in medication. So there's actually medicine for hyperactivity or children who are inattentive. So those ones are also there. Some also have sleep challenges. They will not sleep in the night. Some mothers will tell you, my child doesn't sleep at all. There's also medicine for that. And there are, if the other non-medical interventions fail, yes. And then there are also those with bad constipation or diarrhea, or they sometimes have constipation, sometimes they also have diarrhea. So those ones too, you can help them. Sometimes when the other techniques, so these are the things we do in terms of medical treatment.
Okay. Mr. Nyako, I'll come to you now. I can imagine that it must be a bit of a challenge to have a child living with autism. Is there any help available for parents?
Well, I think there are so much out there that a parent can access. We've mentioned some of the therapies that can be done for every child that has been diagnosed, depending on the level, the challenges that the child has, and all of that. So there are special schools out there. We have some programs that are organized by some organizations that support children with autism. I don't want to mention it, but there are a lot out there. When you talk to the doctors, at least when they finish the diagnosis, they know the centers, they know the individual, they know organization that you can refer you to. It doesn't matter where you are, they know them. They have the list of organizations that support parents. So I'll use this opportunity to advise parents that anytime you have questions about your child development and you have diagnosis, don't wait. Talk to the expert, talk to the doctors. Of course, sometimes it's just about the acceptance. There are some parents who find accepting that, this is not what I prayed for, this is what I'm looking for, and so this is not my portion and not all of that. I think you get to a point where you need to sit up, you need to run, you need to find way to get support for your child because it gets better. It gets better when you provide the necessary support, especially when they are very young. When they are very young, you can turn them around. You can see the progress. When you're giving them the necessary support. So the support out there. And I think that one key issue has to do with parents who find themselves in this situation should find a parent who have gone through the system. I think sometimes it feels like I'm alone. I don't know where to go. Who to talk to. When you see parent support groups, it helps, encouraging parents who have received their diagnosis and where to go and what others have tried and worked. You can also follow up. Of course, there's no one straight jacket therapy that, can support all the children. Like we say, if you see one child with autism, you see one child with autism. In fact, twins, quadruplet, triplet, they are all different. So you tend to do different things to see what works and what doesn't work. So I would say that there are help out there. So parents should not keep their children at home. They should bring them out. Find support in the various schools, go to the special needs centers and seek support. And you will not be surprised that your child has something that you don't want to lose. So there's support out there.
Right.
Okay. To Dr. Nyako.
You want to add on something to it? Okay, sure.
Yeah. So adding up to Dr. Nyako's view, sometimes I think the parents also after their assessment, there are some things that they also have to understand. First one goes with the acceptance, and the second one goes with the understanding, and the third one is the inclusion. Sometimes some parents will walk to you, and after the screening and assessment will say, okay, I'm suspecting this, and they'll go home and see you as you being the devil, you trying to put something on their case. So the first one is the acceptance, because when parents accept the case that, okay, this is the challenges and I want help, that one will give him or her an open space to welcome a lot of people and seek for an ideas. If a parent doesn't accept that, we the therapist going down to do the therapy is very difficult. Sometimes we just have to run about the world, beat about the bush, trying to just use a different diagnosis, like, okay, it's just a speed. Because the moment you mention autism spectrum disorders, be like, like maybe some spiritual sickness or not.
Yeah.
And the second one that I'll hammer more on there is the understanding. After acceptance, you have to understand the case itself, like the levels and the type. Some people goes like the teachers, they think like they know, and indeed they know they are the best parents. People too think like, okay, I know. Meanwhile, they've been using their 1 minute, sorry to use that, using their maybe a flash Google search just to read 1, 2, 3, and they think they have it all in mind. So the moment you want to open up to them, try to engage them, oh, I know this, I've read this, oh, I've been on the internet every day reading about it. So they're always blocking the therapist to interact with them, and to sometimes maybe go down to tell them the specifics or the unique characteristics that the child possesses. And they're always blocking the therapist not to do that. And they're inclusive. Sometimes parents think like, okay, I'm paying Clement, I've paid you, so it's your work to do that. I'll urge all parents out there. After paying me, I just come over to, as a facilitator, or let me say a coach, I'm just coming to find out the uniqueness, a skill, or to work on the particular skill that the child's supposed to have it at that particular time during the therapy. After that, the parents and the caretakers are those who are supposed to carry on these activities and to work on it, because our 1 hour or 2 hours session is not enough. So I'm urging parents, after accepting and understanding all this, there's a lot of help, but the help comes when you open up to understand what your therapists do and to understand the uniqueness of your child's character, so that we can all work together hands on hands.
Yeah, right. So, Clement, you mentioned the therapy sessions. Are they expensive? Are they affordable for parents who need to?
It depends. It depends. It's very affordable. Yeah, it's very affordable, but it's quite expensive. It's quite expensive, and I think sometimes you have to explain to parents that, okay, it can take a while. It depends on your child's cooperative and your child's skills, and so sometimes you can go for therapy for 1 week and the parents will start asking you, Clement, 1 week, I've not seen anything. Yeah, it depends. So we always have to explain to the parents that, okay, this can take a while, or it takes this longer. But we can't give the exact time that your child will be well. Yeah,
Right.
but it's not all that expensive. Every parent can afford.
Okay, that's good to know. Okay, Dr. Mposakodia, you've mentioned that there's a spectrum, right? So there are different extents to the symptoms. But can a child living with autism eventually be able to live independently?
So it also depends on the child's condition. So those who are severely affected oftentimes may be dependent on somebody, maybe for the rest of their lives. But then there are also those who, with some therapy and then training, may be able to live independently. So it actually depends on the child's condition, their intellectual ability. There are some children with autism who are very smart, very, very smart. There are also those on the spectrum who will have intellectual challenges or impairments. So those ones may need to depend on others for the rest of their lives. But then those who are intellectually gifted, who are mild on the spectrum, who receive the proper therapy and training, um, may be able to live independently. So it all depends. And that's why we hammer on early intervention. Children respond differently. That's also one thing that parents need to know. Children respond differently, and the acquisition of the skills, even with therapy, takes a long time. I mean, some catch it really fast. There are also those who take a longer time to achieve the skills or whatever you are teaching the child. And so it's important for parents to know this is not like treating malaria, where after 3 days of treatment, you expect the child to be well. This takes time and a lot of patience and the parents' involvement. So, yes, some of them are able to live independently, but then a number of them are also dependent on others for the rest of their lives.
Right, okay. Unfortunately, we've run out of time. But as I said, we have our experts here. So I'll let them introduce themselves in relation to what they do to help children with autism. And if anyone needs their help, how can they be reached? So we'll start with Clement.
Okay, I'm a speech pathologist. So far, what we've discussed about some of the three major symptoms is having communication difficulties. So anything related to communication difficulties, when you contact me, I'll be of help. Or if you have any questions that you can ask or you want to ask me, or if you want your child to be assessed and you contact me, I can be of help to direct you to all other specialists who are into that field.
Is there any number we can reach you on?
Yeah, possible. I can. My number is 0544 030050.
Can you take it a little slower for us?
0544 030050. Clement.
Okay, okay. I'm sure it will be projected so that people can see it. Mr. Nyako?
Yeah, thank you very much. So Any Foundation has been in existence for about 4 or 5 years. So we provide early intervention for families diagnosed with autism. We usually provide home support. So when it happens like that, sometimes it's difficult to find the right place to go. Sometimes because of the stigma, you want to keep your child at home. We'd rather come to your home and support your child. And like doctor said, and if I also said, when they achieve a certain skills milestone, then we transit them from home to regular school or centers or wherever we feel that the child can make a progress. So we do a more of intensive kind of program. So it's a very holistic program that supports all the children to achieve their goal. And then we do the transition from there.
Okay, so how can we reach you?
Well, you can visit our website, Any Foundation, www.anyfoundation.org. And then on Facebook, you can also reach me on 020-833-2698. 020-833-2698.
Okay, and then finally, Dr. Amponsakodia.
Yes, so I'm a pediatrician and then also the so I screen. I help with the screening of children with developmental disorders, not just autism, the others. And then we also have a therapy and learning center in Kumasi, Ahinsan, and these children who are having developmental delays or disorders come and then receive therapy. So we have therapists who come around and then administer therapy, speech therapy, occupational therapy, and then those with behavior challenges. You also have people who come and help with the behavior. And then we also have um, facilitators who also help them learn the regular classroom things that they are supposed to learn. And we also provide school support. So for those who undergo the intensive therapy and then they are well enough or they've acquired certain skills that we think we can put them in classroom, we also have facilitators who help them in transition. So yes, I'm a general pediatrician. I do screening. We also have a center for these children. And Clement and Mr. Nyako, they are all friends of mine and they also help us in various ways. Uh, I can be reached on, okay, so we are on Facebook, we are on Instagram, Healthy Kids Foundation. If you go on Facebook or Instagram, you'd find us there lots of information on child health, not just autism. And if you want to call us, you can reach us on 055 762 5346. So 055 762 5346. But if you go to Facebook, you find us there, Healthy Kids Foundation. You can find lots of information on children's health over there.
Right. Thank you all so much for your contributions. I've learned so much. I believe the viewers have learned a lot too. Thank you for your time in educating us on autism. So viewers, we know autism is not a spiritual disease. There's help available and support available. All we need to do is reach out to the right people, and we've given out contacts that you can reach our experts on. So please do so. Try and get help. If you think your child has any developmental delay, don't just sit at home and diagnose them by yourself. Try and see a specialist, and then follow-up can be done, and then your child can get the help that they need. Thank you so much for listening to us, and see you again next time. Have a good night.